Oral health is a critical part to overall health and well-being, and yet we have not valued or realized the importance of oral health. So we've not built it into our systems of care. We've not rewarded those who provide it. So attitudes toward it have been barriers to access to oral health care. Part of that is just not realizing the importance of it, but part of it is the difficulty of accessing the system. And I think nursing is key to that. I think nursing ought to be incorporated in this major move to improve not only access to oral health services, but also the quality of care. The major trend that I think is important for nursing education is incorporating oral health care as a key part of overall health and well-being.
For the longest time, I've always had low self-esteem, and a part of it was because of my teeth, you know, because people are very judgmental about things like that. You know, they pick at the littlest things, and I knew my teeth were not the greatest, and I just realized that I had to face the fact that, you know, I had to have all 4 of my front teeth pulled out because there was no way they could save the teeth because they were decayed beyond repair.
It's really the ounce of prevention is much more cost effective than a pound of cure. Nurses, as we all know, are at the front lines of healthcare. Advanced practice nurses, nurse practitioners, clinical nurse specialists, and nurse midwives are really at the front lines of providing primary care and specialty care in a variety of settings. And they really are in a prime position to both do oral health screening, assessment, exams, and management of specific oral health problems within their scope of practice, or make referrals to the appropriate provider. We need to come up with innovative ways to infuse oral health content into undergraduate and graduate curricula. And along with that, to create clinical experiences for students that will enable them to put that knowledge base into action in the clinical arena. We want them to implement effective oral care that increases the quality of care and the quality of life for patients across the lifespan.
I'm excited about a curriculum that already exists. Smiles for Life begins with sharing with all of us as learners the importance of that oral systemic connection, the connection of oral health with overall health and well-being. And it then covers oral health across the lifespan, beginning with caring for children, caring for the pregnant patient, caring for the adult and older adult.
That's the package that the graduate can take with him or her to the clinical practice setting, and it's part of the lifelong learning that the practicing clinician needs to continue to acquire as they continue their career.
The aim of the Oral Health Nursing Education and Practice program is really to develop a nursing workforce to provide oral health care access for the general population. And the real goal of OHNEP is to incorporate and integrate oral health care into general health care in all nursing curriculums, whether it be baccalaureate, associate, or graduate programs in this country.
The mouth is a window to the body overall. That window can tell you a lot about what's going on in the body in terms of diagnosis, but by the same token, diseases of the mouth can affect the heart and the whole system with a disease like diabetes, for example.
I guess you could say it takes a village, or it takes multiple health professionals collaborating in an interprofessional way to really come up with a comprehensive solution to the problem.
What we really have to do is educate the faculty. They need not only the knowledge, but they need the tools, the techniques, the technologies, so that they can incorporate this in their classes, their simulations, the clinical experiences. They need to be able to collaborate with other interprofessionals and then to disseminate this knowledge so that we'll all be on the same page and able to provide oral health care for a greater population.
The idea is really about getting providers to talk to each other, to provide a patient-centered care. And so I think a lot of those conversations are happening now. The interprofessional collaborations that we're seeing across the country, really, in many universities, I think ultimately will lead to more coordination of care across settings, across disciplines, which will improve patient outcomes. I think we're getting a greater understanding that there are certain aspects of preventive care that across the board health professionals can provide. Think about it from the patient's perspective. What is the value added to a patient of having professionals work interprofessionally? The value is that the patient gains from the knowledge of a team of professionals that are taking care of them, and that their health professional is not siloed in their sort of knowledge base either.
I think obviously nurses who care so much about patients would readily follow this lead throughout the country. I'm very pleased that there's this excitement about improving oral health care in this country.
The way my teeth looked before really did make a difference. Now I know that people are not just staring at me because I have rotten teeth in my mouth. No, they're staring at me because I'm smiling and I'm a happy person and I'm confident in myself. Whereas before I wasn't confident in myself. And I was always trying to hide my smiles. And now I don't have to.